Live and welcome to our discussion on Stephen King's Carrie. So, through the psychiatrist lens, where would you like to start? And again, if you could just speak up, shout at me so everybody on the other side could hear us.
I think early on in the movie when she's in the shower after gym and it's like a weirdly sensual scene at first, and then she ends up getting her period and is like very disturbed by it and has no idea what's happening, and she is yelling and screaming and asking for help, and everyone kind of laughs at her, which becomes a bit of a recurring theme throughout the movie.
So let's look at this biopsychosocially, because I think if we, there's 2 points to be made here that you just captured. One is the biological and one is psychosocial. So biopsychosocially, biologically, from a third-year medical student's perspective, what is that scene about?
And then her body changing. I mean, that's not a very third-year medical student.
If you needed basic science courses in physiology to answer this question, what is the answer I'm getting at? What is the single best diagnosis for that scene for Carrie White? Why is she so surprised? Non-scientific answer.
Well, I mean, no one ever told her about it. I don't know.
Okay, right. And describe Carrie to me. I don't know who Carrie is. Give me the first couple lines of her HPI.
How old is she? I don't know.
How old do you think she is?
14, 15.
Well, she goes to the senior prom.
Oh, 16, 17.
Right?
She looks younger.
Things are actually now just making sense now that I know she's a senior.
Okay.
Anyway.
So she's a 17-year-old Caucasian female who was in her usual state of health until blank when she presents with having her first menses, right?
Mm-hmm.
What now I want the third-year medical student back. You've taken your M2 basic science course. What is the single best diagnosis?
Primary amenorrhea.
Yeah, primary amenorrhea, right? So this movie does begin with establishing that this particular character has primary amenorrhea that we need to code in Axis 3 if there were such thing as a multi-axial system, right? All right, now, same scene, give me the psychosocial perspective, her being shocked and surprised. What's going on here?
Well, if everyone in her class has gotten it, years ago, and she's like late to get it, that would be, I guess, something to make fun of if she's like late to develop or doesn't really fit in, or just makes her seem like juvenile, I guess.
Mm-hmm. And what are some psychosocial factors contributing to her feeling juvenile?
She's kind of sheltered by her mom.
Yeah, kinda.
She's very sheltered by her mom.
Well, you're very polite. Are you going into pediatrics?
No.
Oh, that's what you said. So, biopsychosocially, in that one scene, all of a sudden we realize that we have a patient, a fictional patient, that has primary amenorrhea and has an overprotective, quote-unquote, sheltering mom. Okay? So that begins to paint a picture for us. What else do we know? So we can move forward from this. We clearly understand, and it is clearly established that she is a victim of bullying. All right? What else do we know?
She's a victim of bullying from multiple perspectives. She doesn't have a lot of control over her own life because at school she's kind of put in this box by her peers and doesn't have a lot of autonomy with her social life. And then she's also put into a different box by her mom, which we see pretty quickly when she comes home after she's dismissed from school. She's also very self-aware around her mom. I noticed that when she was coming down the stairs, or she was trying to listen to what the mom was saying on the phone, and the mom was so acutely aware of her that she knew that she was listening without seeing her. And then when she was coming down the stairs to talk to her mom, she was adjusting her clothes and changing her demeanor a little bit around her mom to be accepted into this box that her mom wants her to fit in.
I want an analysis of what you just said. Well, I mean, again, a normal person will watch Carrie, will watch that scene and think, oh, look at her. She's very intuitive about the way she should present herself to her mother. However, a third-year clerk at Robert Wood Johnson Medical School has a bit of a deeper understanding. What is going on here? And feel free to use the word Freud.
She trying to be like her mom?
She could be. What would make her think to be like her mom or act like her mom? Don't overthink this.
Her mom telling her that's how she should be.
Exactly right. Exactly right. And when our parents tell us the way we should act and the way we should feel, what part of us begins to actually evolve that then keeps those types of prohibitions in place?
Super ego.
Yeah. So this is a character that is super ego driven, largely as the result of a very domineering, authoritarian mother figure. And we see that in this scene. Again, how brief is her fixing herself before she sees her mom? That nonverbal communication, as brief as it is, tells us volumes. All right. And then once we understand that, and that we continue to watch Carrie the film as a fictional case of whatever it is that's going on, we can pick up then on other behaviors that clearly reinforce this notion that this is a character that is super ego driven. And when something or somebody is super ego driven, all it takes is a crack for that impulse to come through like a volcano. Now, by the way, watch what happens at the prom. Okay. What else do we see here before the prom? Anything else?
Just, I guess, like, one thing that's kind of struck me was, like, just in terms of, like, Carrie's relationship with her mom was when the mom was, like, yelling at her Carrie to, like, recite these Bible passages, and Carrie was being a little bit, like, disagreeing with her mom and was questioning it, saying, like, I didn't sin, and the mom drags her into the closet. Even after going through all of that, when she comes out of the closet, she thanks her mother and then tells her that she's going to go to bed.
The thank you scene, do you feel that it's genuine? Or do you think, again, it's her with a conscious effort to act a role? And there may not be a clear distinction, right? I mean, it certainly could be a little bit of both.
I wasn't really able to tell, to be honest.
Yeah.
She almost seemed, like, kind of genuine about it, which, like, scared me a little bit. Like, wow, like, how could you be, like, genuine about that?
Well, stop there. Stop there. How can someone be genuine like that?
Well, I mean, if you take Catholics, like, Catholics are known to be very I'm forgetting the term, but, like, a Catholic will punish themselves and be happy that they are punishing themselves and keeping themselves in line with what they've been taught. And so I feel like that is more of an example of kind of, what she's demonstrating.
And I'm going to just put a little bit of different terminology to what you just said, and that is that individuals who, in this case, are focusing on religion as a guide, and how one governs their behavior is guided by what is referred to as the reality principle. The reality principle is what dictates the superego. So if someone's superego driven, they are basing their behavior on the reality principle. Of course, the opposite, the id-like behavior, would be the pleasure principle. Right? So two opposite and opposing principles that guide different aspects of who we are. And we see that in this case as well. But how can a person who is, and the observation was that she was literally dragged in the closet and looked like she was thankful and loving to her mother in literally the subsequent scene.
I think it was genuine, just because I think my interpretation of it was like when the preceding scene where she felt a lot of it like out of control because she like discovered this new information. Her mom is like berating her, saying that like she must have sinned, otherwise you like wouldn't be bleeding and all this other stuff. I think she was like very out of control and things had just changed very drastically for her. And then when her mom put her in the closet, I don't think it's necessarily like thankful to her mom, but like I think she appreciates like the self-containment that she was able to gather from that experience when she was in the closet, because it helps like her relieve tension, I think, to be more self-contained. because things were like spinning out for a while before she was put in the closet, and that obviously kind of like tilted her access a bit.
I agree. I think we're on a path right now. I would like to continue on this idea of self containment and being relieved. I still want to get to the root cause of this. That in a way, she's thankful for mom for having done something here, right? Mom saved her from something. What did mom save her from?
Saved her from her id impulse.
Go on. And what would happen if Carrie was allowed to continue to act according to the pleasure principle?
I mean,
Would
she
that
would be in
like
control.
like,
Sorry, go ahead.
is it, like, would that be like I guess the crack you're talking about, where like everything kind of fall apart if like there's like not that balance in her superego and
That's true too. I mean, we would like an equilibrium. We wouldn't like one to really be that dominant because, again, one crack, and this goes in either direction, could really end up with significant results. I mean, clinically significant distress or impairment. So that's true. But what ultimately is guiding this? I mean, and the answer kind of lies in in a psychological theory. What's she thanking her mother for? No? What would happen if anyone, whether we named her Carrie or whatever else, what potential consequence might anyone believe be the end game of acting according to your id? There's a reason why you're not. I mean, again, you got the white jackets on. If I asked you where you want to be right now, if you said here, you're lying to me, right? Because again, the id says eating, sleeping, or sex, and there's no food on the table, right? So you are not guided by your pleasure principle, which means that you are not being guided or governed naturally. You're not. You're superego driven. Most medical students are. What the heck? Now, for you, there are both immediate and long-term rewards for doing this. The immediate, of course, is your grade. Carrie's not being graded. Right? There's no honors at the end of her 5-week stay with her mother. But there's also long-term rewards that some people believe are in place too. For Carrie, what is that?
is it her religion like you're talking about before?
So what is it?
Like not like she's like I guess like in God's eyes she's like clear. She's not like
So what's the end game?
to go to heaven.
Yeah, salvation. There are people who believe that, right? And and let me kind of just put a wrinkle in the plot of Carrie, which doesn't exist, but we're going to pretend it does. What if this fictional character was provided a diagnosis of malignant melanoma, stage 4? What then? How might her behavior change? Because one potential answer is that it wouldn't. Because even though she has a 5-year survival rate that none of us want to talk about, poor prognosis, she believes that there's salvation at the end of all this, so it's going to keep her id in check. Where someone who doesn't believe is at greater risk for demonstrating behaviors that could be more id-like, and therefore guided by the pleasure principle. What would you do if you found out that this was the last day on earth and there was no such thing as an afterlife? And I'm telling you, the idea of sitting at a table with Tobia sounds great to me, but you're lying to yourself as well to me. That's what's guiding. That's existential theory, right? So Carrie, the film, now pivots to an existential case study, albeit a fictional one, where we see someone that is overtly superego driven. She believes and is made to believe that there is this reward that's awaiting her. That's why she thanks her mother for salvation. What else? By the way, existential theory, how with the inevitable outcome that we all and universally share, do we continue to operate and be able to function as human beings when we know the outcome of this? That's existential theory. I don't want to really get into that right now because I don't want anybody getting depressed. It's 1 week before your finals, before your shelf exam, but that's existential theory, how we make sense of it all. Right? And that's what Carrie is struggling with. And her mother is really taking the forefront to ensure that she has provided an answer. What else do we see in Carrie?
The telekinesis.
What's that about? And I'm going to throw pyrokinesis in there too. She's got both going on. We'll just lump them together.
I think she can't express her emotions like in the way that other people can, so she gets these superpowers.
Why can't she express her emotions? And you're exactly right. This is a wonderful, albeit overly dramatic, depiction of non-verbal communication. Right. So let's be on record. In real life, people who communicate non-verbally do not set fires like this. And although there is a phenomenon that is actually called communicative arson, in which they actually do set fires to communicate their inner feelings. And we see it in individuals who are severely cognitively impaired. So chronic and severe schizophrenia, communicative arson. So there is that exception, but otherwise, people who are struggling with mental illness do not set fires like this. They do not move objects, right? So it's just an over-the-top Hollywood dramatization of nonverbal communication. Why can't Carrie just use words to describe her inner feelings?
Maybe she's never taught that language.
Well, the language comes naturally, right? About the age of 2, and you saw this. If there's a slide I put into and included in your somatic symptom and related disorder PowerPoint, right? Has those milestones, and at 2 years of age, 2 3-word sentences are being formed. So, what's going on here with this particular character?
She probably doesn't want it. She probably doesn't want to speak it into existence. Like, she is experiencing these things, and it would be like almost too much for her to admit it out loud. Like, she would get very upset and out of control if she did that. So it's kind of like manifesting in these like powers, because she's trying so hard, I think, to be self-contained that it comes out in this way.
So again, a very dramatic form of isolation of affect, where she expresses something but is not going to be emotionally invested in what she's trying to express, because to get the idea to conscious awareness, to get the idea to the cortical level would be way too threatening. Right? So there's something going on that's taboo and deep-seated in this character's id, that she is making a subconscious effort to repress or to isolate. And somehow that's being manifest as telekinesis and pyrokinesis, the Hollywood version of nonverbal communication. I agree. I could buy that one.
And I think specifically she feels very like contained by like her mother is like kind of like suppressing her, as well as like her religious beliefs. And I think there's like an interesting scene where she's like in her room and she sees like Jesus' reflection in the mirror, and the mirror starts like bending, and then like the glass breaks. That was kind of like a manifestation of like her telekinesis. And I think that was kind of like, I don't know, it could be wrong about this, but like to me that was like a depiction of like he was like watching her, and like she feels like he's always kind of like watching her, and she has to like contain herself to abide by like, I guess, her morals, as well as like her mother's rules.
Yeah, I'm not going to use the word suppression. I'm going to use the term repression here for Mom. So there's no doubt where Carrie learns this defense mechanism. She learns it directly from Mom, and she is repressing some id impulse. And that id impulse, whatever it is, cannot come to conscious expression. And as a result, we see telekinesis and pyrokinesis as forms of nonverbal communication. Right. I love the mirror scene. I want you to hold on to that, though. Okay? Because there's a lot to talk about here, but I want to finish this thought first before we actually make that jump. Right? Because that mirror scene, I think, is one of the more pivotal scenes to understand in this film. So please remember it. All right. So we have a 17-year-old Caucasian female with past medical history significant for amenorrhea, who appears to be repressed, who appears to have a maladaptive defense that manifests non-verbally. We'll just leave it there. Okay? Any other observations about this dynamic, about that id impulse, the telekinesis and pyrokinesis? Why again, other than the impulse being taboo, might there be another reason why she's having difficulty putting words to her feelings?
think a lot of like her issues that she doesn't. I think obviously all of her issues stem back to her mom, and the issues that she has with other people throughout the film are just like mini manifestations of things that her mom has like instilled in her and reflect what her mom has told her and how she thinks her mom feels about her. Because like her mom is obviously not very accepting of her. Her mom is obviously very critical of her and says all these things about like, you know, you sin, you're unclean, this, that, the other thing, always commenting on the things that she does wrong. And then when she has these interactions with like people at school who are bullying her, I think it's just like a reinforcement of her low self-esteem and like lack of acceptance from her mom demonstrated in her like interpersonal interactions with other people. So I think if she tried to express on a daily basis how she felt about those interactions with these other people at school, it would come out as a much larger issue for her related to her interactions with her mom. And because that's like essentially her whole life and what all this is rooted in, it would be like way too big for her to unpack.
Actually, I love the observation because what you just now I put on the table for a bit of a broader perspective is looking at behavior from both factors that predispose and precipitate versus those that perpetuate. And I think we've really, at this point, as a treatment team, recognized what some major and significant perpetuating factors are, and that's the bullying. So you use the word reinforcement, you're exactly right. Another word we could use here is perpetuating factors. Perpetuating factors similar to those that precipitate and those that predispose may be biopsychosocial, and one social perpetuating factor is bullying. So whatever the reason is that this particular character chooses, and I'm going to use that word loosely, nonverbal communication, her use of nonverbal is going to be reinforced or perpetuated by the bullying because she's realized when she uses words, they're not working. So best to go back to the nonverbal form. The other thing, well, let's leave Carrie alone for a second. Let's use a generic character. When a person, whether we call him Michael Myers, whomever, has a significant difficulty putting words to their feelings. And we know that this likely is the result of some disruption during the time of language development, maybe as early as 2 years of age. Again, those developmental milestones presented in your PowerPoint. What might be something that we need to inquire about as to why? Why would that language development be derailed? Yeah. You know, and the fact that dad is not in the picture now, I think, is put into a different light. So we've got to keep that in the back of our minds, too. People who are traumatized, children who are traumatized when they're young, often revert to nonverbal means to communicate. Right? So we've got to keep that in the back of our mind. There might be early childhood trauma that informs the fictional case of Carrie. Good. Wow, a lot here. So, what other part of this movie do you want to talk about focusing on the character of Carrie?
Her relationship with her gym teacher.
Okay.
Seems like she's kind of another maternal figure, but also like in the scene where she's like telling Carrie to put on makeup and do her hair and go to the prom. She's telling Carrie that it's okay to act on some of those natural wants.
Mm-hmm. We'll use the word id.
Id.
Makes it feel more comfortable. And boy, did she pay the price for it. Why?
Why did she pay the price?
Yeah.
Well, she kind of just from a plot perspective, she encourages her to go and leads her to be in this situation where she is humiliated in front of everyone and she ends up dying.
Yeah. Mm-hmm. One thing to consider here is whether or not the gym teacher is a displaced mother figure, a displaced mother object. And I think that becomes central to this movie. So displacement is another, unfortunately, maladaptive defense mechanism utilized by Carrie White. And that might underlie the demise of this gym teacher, because it seems like she had good intentions, and despite the fact of what happens in that gym at that prom, those good intentions are overlooked. There's a bit of splitting here. This happened, it's your fault. So we're not getting any deeper than that. Your intentions may have been benign. Doesn't matter, you're dead. Right? So there might be splitting here. Anything else? Let's focus on that prom, since we're there.
Well, it's related to the prom because of the pig's blood, but I thought it was interesting that they used a pig, first of all, and also that, in that scene, they're very brutally killing that pig before to get the blood, and I thought that was an interesting representation about it was a nice comparison between people like them and people like her, where they, if you want to talk about it, they're slaughtering this pig and beating it to death. Almost they look very out of control and compared to her, and it's almost interesting that maybe this is a me problem, but throughout this movie she's doing these ridiculous things with telekinesis, and that to me, I was oh my god, look at those people, they're so disturbing, they're slaughtering that pig. And I found that until the end, obviously, when she kills everyone at the prom, I found that more disturbing than the things that she was doing throughout the movie.
Yep. Well, I want to know other people's reactions to the actual killing of the pig scene.
Kind of felt the same. Yeah, just very brutal.
I don't think there was any doubt of the intention of Brian De Palma for that scene. I won't buy into the idea that, he just meant it to be a killing of the pig, and he kind of just was edited the way it was, and it's just a trial and error type of thing. No way. The brutality there is intended. Why? And this is a part where I don't know if De Palma will be able to answer, but we will. Through the psychiatrist lens.
Do her classmates?
Nice connection there.
I think two different lines of thought is one, that they are it's a nice representation of people who are controlled by their id, they're trying to just doing whatever they want and don't really care what happens. It's just something they wanted to do, especially because I think I don't remember the girl's name, but the girl's cheering for him as he was slaughtering the pig. And then the other thought is the pig is somehow a representation of Carrie and the brutal things that they were doing to her, because I kind of looked it up, and pigs are unclean according to the Bible, and she that's how she felt about Menarche, and her mom thinks that Carrie's unclean, and it's kind of a nice representation also of her and what they were doing to her based off of their influences.
I think the symbolism is unmistakable, that the pig is Carrie, and the pig's blood, especially when it spills on her, is nothing more than a flashback for her of her first menses. There's no doubt about that. The symbolism is, I think, very straightforward. The part that's not quite as straightforward is getting to the actual slaughter itself. Let's say, and I'll put words in everybody's mouth for teaching purposes. Let's say that everybody's in agreement that it was a brutal scene, and the brutality was over the top. I'm going to try to state this question carefully. Who would disagree with us? You mentioned people with antisocial personality. Yeah. I agree, but it's not what I'm getting at. Who else? I'm using the word who loosely. No?
Are you getting at that? All humans are essentially animals.
Yeah, any animal would. You ever watch National Geographic? Nat Geo channel? That stuff goes on all the time. Do you turn away from it? Do you hide your eyes from it? Do you shut it off because of the brutality that you see play out in nature? You do. Oh, good for you. You're a mom and dad's blessing. Most of us don't. Why? It's acceptable. We expect that. But it's unexpected here because of the formed or evolved cerebral cortex. We expect different. We expect an id. We expect a superego that's governed by the reality principle, and we don't see it. So, and I think Stephen King and then Brian De Palma kind of redirect our attention here, that the brutality of this scene is in the eye of the beholder. And from nature's perspective, there is absolutely nothing wrong here. But from an unnatural perspective, a human perspective, there absolutely is something wrong here. And that symbolism is unmistakable and has everything to do with the thoughts of these predators towards our main character. What else is going on in this prom?
I was just kind of actually confused. I didn't really understand the guy who took her to the prom, and like how him dying by something that was not related to what she was doing, right? I don't think she caused the bucket to fall on him, right? Like it just fell on him and he died. I was just confused about like why he died not by her, like what the significance of that was. Actually, I didn't really have too many thoughts on that, but it was a point of confusion.
I honestly have to think that through a little bit. So he died from head trauma?
Yeah.
Yeah, the bucket.
Yeah. I mean, again, when this is a loose association that only someone in medical school would say, so this clearly is not anything the author or the director would agree to. But when you look at this hybrid, when you look at this apparent dichotomy between, as we just put it, nature versus the unnatural human perspective, that is the id versus the superego, one entity, one illness, one diagnosis that kind of cuts across both would be traumatic brain injury. And that does come up on shelf exams, right? Someone who's on the human side who presents to, let's say, a physician with new onset aggressive behavior being sexually inappropriate, the first thing you have to think of is frontal lobe pathology, right? And although the biopsy showing occlusion bodies gives a nice diagnosis of PICS, which is very, very common on shelf exams, traumatic brain injury is probably the most common cause. Right. So again, a bit of a reach from a psychiatric or medical perspective, but one that is very common. The TBI is usually the most likely diagnosis of someone with an abrupt change in personality characterized by violence and sexual aggressive behavior. What else with the prom? Anything else?
Oh, just like I guess when Carrie is kind of like killing everyone in that whole scene, it's like repeating over and over, like, oh, they're all gonna laugh at you, they're all gonna laugh at you, which is like what her mother had been telling her like beforehand. So just kind of like, yeah, that was like kind of an interesting scene.
And what's going on there? Specifically about they're all gonna laugh at you.
It seemed just kind of like she wanted so badly to believe that her mom wasn't going to be right and that things were different now. It was like all like flooding back to her and being like that was like actually what was happening. So I don't know if it was like a flashback or like I'm not sure, like just intrusive thoughts or.
Were they actually laughing at her?
Probably not.
Yeah, I think they were laughing at her.
Teacher killed everyone.
Liked her, was like laughing. And,
Yeah, I don't think so.
I don't think anyone was laughing. I think
Right.
she made it. She was having these intrusive thoughts about that, and she kind of maybe not hallucinated, but she like so truly believed that they were, even though they weren't, that she killed them.
No, I think you're onto that. I think you're onto something. They weren't laughing at her, and it connects to your observation. Her mother told her this. So there is a memory of being told this over and over again. That memory becomes a thought, and that thought at some point stops from being identified, that is insight, identified as a product of her mind, and therefore is experienced as an auditory hallucination. So through a flashback, that's exactly what happens. And no, they're not laughing at her. but her reality is that they are, largely as a product of this progression of this intrusive thought, the lack of insight, and therefore that thought being experienced as coming from outside of her head and therefore not a product of her own mind. It's exactly what's happening here. Any final thoughts?
Well, when she goes home and her mom tries to kill her, and then she's in the kitchen, like after she gets stabbed, and then she ends up killing her mom with the telekinesis powers. It's interesting because we're talking about like this telekinesis being a manifestation of her being unable to like properly voice her feelings, and it being like a reflection of her self-containment for the, not for the better. How she's like using that like self-containment to like kill her mom. And I thought that was interesting.
Yep. So, a 17-year-old Caucasian female presents with a past medical history significant for primary amenorrhea, demonstrating clinically significant nonverbal behavior, and apparently impulses of matricide that are communicated to her mother nonverbally. Mother, maybe I'll even rephrase this, communicated to an overbearing, omnipresent mother, nonverbally. What's Carrie really about? 17-year-old Caucasian female, past medical history significant for amenorrhea, presenting with clinically significant behavior as demonstrated through nonverbal communication about an overbearing mother.
An eating disorder.
Yeah. Yeah, too bad she wasn't wearing baggy clothes and was underweight, because it would be a perfect manifestation of anorexia. Oh, by the way, she's underweight and wears baggy clothes. Even the final scene where she is killed, that his mom is killed by knives in a kitchen, is heavily symbolic of an eating disorder. So what causes an eating disorder? We'll start with anorexia nervosa, that eating disorder that is defined through the cardinal trait of a fear of gaining weight despite being underweight. That clearly distinguishes anorexia from any other eating disorder. Right? Not the restricting, not the binge eating and purging, but the fear of gaining weight despite being underweight. Is a form of nonverbal communication. Right? There's an impulse that I want to kill my mom. That impulse stays in the id, stays in the subconscious. It cannot possibly come to conscious awareness because of a intact, in this case, overbearing superego. That's not allowed. So it must be expressed in a distorted way through a defense mechanism so that an individual can discharge the anxiety, but in a socially appropriate form that the superego's reality principle will allow. So it's not going to come to conscious awareness in that form, but in a distorted form through an ego defense, it certainly does. Now, the psychodynamic theory of eating disorder, not in an exam, but certainly supportive of this film, is that it's usually a child, adolescent, just simply substitutes, or through the defense of displacement, substitutes disordered eating for a more or the more age-appropriate conflict. For a 16 or 17-year-old at the prom, what is that age-appropriate conflict? What's the impulse?
This might be totally off base, but like sex.
Yeah, absolutely. Right. This is someone who is incredibly sexually inhibited, and that id drive, and it could only be sex, eating, or sleeping, is going to be thwarted thanks to her overbearing mom's development of that superego, or influence on that superego. So dynamically, Freudian theory, the individual simply substitutes preoccupations about eating for the preoccupations of those more age-appropriate pursuits, specifically sex. There's no doubt why this all comes to a head and overflows at a senior prom. The psychoanalytic theory takes it one step further. The omnipresent mom, the overbearing mom, and that wish, that impulse to kill her is internalized through the defense mechanism of internalization. Internalize the mother object, then starve her to kill her, symbolically. That's an analytic perspective. So any movie that casts usually a young female, but males can have eating disorder too, but characteristically, demographically, a young female who commits matricide in a film is always symbolic of an eating disorder, specifically anorexia. Symbolic. Per the analytic theory, psychoanalytic theory. Internalize the mother object, then kill her by starving her. The fact that Carrie's mom dies at the end of this film fulfills that symbolic outcome. Any movie does. Well, any movie about matricide would. When you see a mom die in a movie at the hands of her daughter, and you think of Freudian theory, will not show up in a shelf exam, but again, makes this movie about eating disorder nonetheless, you begin to look for signs and symptoms that would support that working theory of anorexia as the most likely diagnosis, and then the primary amenorrhea, then the history of sexual abuse when she was young, or I should say suspected sexual abuse, and then her being underweight. All of that falls into place then. There are two forms or subtypes of anorexia: binge eating and purging, and restrictive subtypes. Binge eating and purging, consistent with signs and symptoms of cluster B personality, Carrie does split. Okay. We don't see her binge. We don't see her purge. This is not Black Swan. This is not an over-the-top representation, a straightforward or direct representation of eating disorder, such as anorexia. It's heavily symbolic. Restricting subtype is more consistent with cluster C personality traits, right? Avoidant versus dependent versus obsessive compulsive personality traits, right? So the binge eating and purging subtype is more amenable to the SSRI therapy. So if you're going to put together a biopsychosocial treatment plan, cognitive behavioral therapy is the mainstay, irrespective of subtype. However, with the binge eating and purging subtype, you can add on the SSRI, because anything that includes binge eating and purging shows some efficacy of the SSRI, or would be improved from an SSRI. Bulimia nervosa, on the other hand, is a eating disorder that also shares with anorexia a disturbance of body image. So that's not different, nor are the actual behaviors. We don't call it restricting, though, when we point out bulimia. We call it binge eating and purging versus non-binge eating and purging. So two subtypes. Take-home message is that binge eating and purging can be seen across the board for any eating disorder. It will not help you differentiate one from the other on a shelf or in clinical practice. What differentiates, because both are self-image disturbance, is that one has a fear of gaining weight despite being underweight. The other does not. That's as simple as it is. The other, bulimia has nothing to do with being underweight, and therefore bulimia has nothing to do with any fear of gaining weight. Both are self-image disturbances, and both can present with binge eating and purging behavior. Questions about Carrie? So we're going to switch over from Carrie White to Snow White.
I guess the last thing I just wanted to say is, do we want to talk about the mirror scene or move on?
Oh, yeah, well, there's a segue.
Okay.
The mirror scene's right out of Snow White,
Yeah.
right? I mean, it's body image, distortion of body image. That's why that mirror flutters the way it does. Symbolic, consistent with eating disorder, right? Consistent with anorexia as well as bulimia. But it has everything to do with body image, right? Looking in the mirror and how body image is governed, or one's self-worth and self-value is influenced by body image. Some people can look in the mirror, see that they're short, they're overweight, they're too tall, they're under, whatever, and understand that I am still good. An individual who has their body image significantly impact their sense of self-worth has a risk factor that is consistent with or at risk for developing the eating disorder. And that vanity, I'm using the V word because I want to apply this now to Snow White, is seen in the fairy tale as well. Right? So that's the segue, and now we can talk about, I think, Carrie's sister, Snow.